Guillain Barre Syndrome is a rare but serious post-infectious autoimmune neuropathy characterized by the destruction of the myelin sheath of the peripheral nerves. Up to 70% of patients with Guillain Barre syndrome reported antecedent infections before the presence of GBS symptoms. Gastrointestinal infection caused by Campylobacter jejuni represents the most common cause of the disease. In fact, culture and serologic evidence of Campylobacter jejuni infection is present on up to 40% of patients with GBS. Other organisms associated with GBS include HIV, cytomegalovirus, Epstein-Barr virus, influenza A virus and B virus, and Zika virus are other infectious organisms associated with GBS. Other rare causes are recent surgery, medications and vaccination. There are different subtypes of GBS, which differ upon the area of weaknesses. Acute inflammatory demyelinating polyradiculopathy and acute motor axonal neuropathy are the most common. Clinical presentation of the disease is heterogeneous, but in acute clinical phase typically present with weakness and tingling sensation in the legs that sometimes ascend to the arms and upper body. The disease requires close observation in the hospital because of its potential risk to cause respiratory failure, loss of ability to walk or death. Weakness may progress until the patient becomes almost totally paralyzed, in which the patient experiences respiratory failure, which can be life-threatening. Respiratory failure can affect up to 30% of patients due to the involvement of the lower cranial nerves to the muscles of respiration. The diagnosis is characterized by the recognition of signs and symptoms, clinical examinations and nerve conduction study. Nerve conduction study is an electrophysiological procedure done by a neurologist in which electrode patches are attached to the skin to simulate the nerves, after which the speed of electrical impulse is measured. Intravenous immunoglobulin is the most common treatment of the disease, in which antibodies from highly purified plasma from thousands of healthy people are infused into the vein of the patients. It's important to talk to your doctor or other professional before beginning any sort of supplementation or treatments. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.